Good evening. Welcome to the regular monthly meeting of the Lynbrook Board of Education for August 11th. If we could all please rise, and Mrs. Yaker will lead us in a salute to the flag. Roll call, all present. May I have a motion to accept the minutes of the July 6, 2021 reorganization regular meeting? Mrs. Marcus, second Mrs. Hanson, all in favor. May I have a motion to accept the minutes of the July 14th, 2021 special meeting? Mr. Pileski, second Mr. Murray, all in favor. Actually only had 5 members in attendance that voted on that. As we get into the meeting, we have some new staff members, always an exciting time. We'd like to welcome those new staff members in attendance tonight. If Kelly McMahon could please stand up. Elementary school teacher at Marion Street, welcome, congratulations. Jackie Reef, please stand up. School media specialist, West End and Kindergarten Center, congratulations. And graduate. Lauren Behan, can please stand up. Part-time general music and chorus teacher at Waverly Park. Congratulations. We have other new employees who are not in attendance. Natalie Sherry, social worker at Marion Street. Maria Pinheiro, psychologist at Marion Street and West End. Carrie Lynn Surdy, psychologist at the high school. Anna Upston, general music and chorus teacher at Marion Street. TAs at Marion Street, Kathleen Lucia. Caitlin Bear, special education at West End. Erin Dowdy, special education kindergarten center. Denise Goldberg, kindergarten center. Julia Healy, kindergarten center. Andrea Enriquez, kindergarten center. And Carly Tansky, kindergarten center. Congratulations to you all. Traditionally, we'll take a few minutes break for those new employees who showed up for their recognition, that you may leave and enjoy the rest of your evening. You're all welcome to stay, but we'll give you a few seconds to depart. Don't be nervous, you can go. Moving on to reports from trustees. We'll start with the audit committee. Mrs. Danino.
So the district is currently undergoing 3 audits simultaneously. The New York State Office of the State Comptroller is conducting its 5-year audit of district operations. The audit committee reviewed the plan for the annual external audit in June. Field work is currently underway and it should be completed by the end of the summer. And the internal auditor is taking a deep dive into information technology and will be issuing its report to the audit committee at our September meeting.
Thank you. Also, we were lucky enough to have a tour of the high school and the construction that's going on. It's amazing how much work has been done. We anticipate a ribbon cutting ceremony, I think, on September 1st, but it was really just amazing. Kids will be very excited to see what they're doing and the space they now have in a lot of our different departments. So I'm looking forward to that and the kids being able to enjoy that opportunity. Also, just wanted to mention a bunch of school board presidents on Long Island, starting about a month ago, I guess we have to give recognition to Massapequa, has been getting together to try to unify our efforts in how we're addressing local control issues with school decisions that are being made. And while I'm upset that King Cuomo has left, there will be some time now to find out what direction Albany will have and what direction they're giving to the school boards. But we're hoping to be unified in a lot of decisions we make. But at least by communicating with each other, we think that we'll be more unified and stronger in our positions if we all at least communicate and agree on that. So I will keep the board members and the community up to date. And I think as we're going to find over the next month, there's a lot of things, a lot of changes being made very quickly. And I think a lot of things are still to be decided between now and the first day of school. But there'll be more to that as this meeting continues. Moving on to old business, on the universal pre-K. So we have an update on that. As you know, the district received funds for a universal pre-kindergarten program. Since we do not have the space for such a program, we sought a proposal from outside groups. And I think Dr. Burek has looked into that and has some information for us.
Thank you. It is anticipated that this evening the board will adopt a resolution that approves a contract with the JCC to be run at the 1 Saperstein Plaza in Lynbrook. Since the July meeting and since the proposals were opened and reviewed, the district has been finalizing that contract with the JCC in order to provide this UPK program. Before the board approves it, I would be remiss, though, if I did not share an unfortunate incident that occurred in mid-July, and this is just for full transparency. The executive director had reported a supervisory issue that led to a code violation at their summer program. The JCC actually took swift action and terminated those involved in the matter, terminated them on the spot. The district team, Dr. Balekis, Dr. Lynch, and myself held several meetings with the executive director and actually the new director that will be on site for this program at the Lynbrook campus. The new director has 6 years' experience working at the Oceanside campus, which happens to be their flagship campus for the JCC. There is a new supervisory plan in place, as well as mandatory training for all staff working in the program. And we believe that with the staffing changes and training, that this particular campus is going to be in great position. The district will also be actively involved in the program. We'll be conducting our own visitations throughout the year, and we feel comfortable that the new staff will work in partnership with the district to provide this UPK program for our students. So, with that, we feel comfortable the board moving forward with the JCC program for UPK. And that being said, then, once the resolution is adopted, the lottery will be held for those who have submitted their applications, and actually you have until noon tomorrow to submit an application. We are up to 80 applications for the UPK program. There are 48 positions, so at 9 o'clock we will be live streaming a lottery process. And we will be posting the results of that on the website as well. After this meeting, the link for that live streaming will also be on the website. You should see, if you go to our website right now on the landing page, you see the information about the UPK program. After tonight, you will see the added link for the live streamed event at 9 o'clock on Friday. That's it.
Well, I thought I'd have more questions, but that was a pretty comprehensive explanation of what took place. And I think we're comfortable knowing, at least I'm comfortable knowing, that there'll be some oversight or at least good communication between the district and the organization. So any other questions from board members on that issue?
No, I was just happy to hear. I know they've had I've heard, success from the other programs that they've run, and that director has been in place for quite some time. So I feel comfortable with that director being on site here.
Moving on to new business under building inspections. Every year, the board, along with other stakeholders in the community, we inspect the different buildings in the district. We're going to look to identify volunteers for that. How about for the KC and administration building?
That's August 30th, yes.
August 30th, Pulaski and Yaker. High school?
No, September 14th.
North? I'm going to slide that over.
North and West End are on September 1st.
Mrs. Hanson? High school on September 14th. We just did that one. West End on this one. And then South Middle School and Marion Street on September 20th. Mrs. Hanson again. Thank you. All right. Anything else from board members? This time we'll move on to Dr. Burek's superintendent's report.
Thank you very much. Unfortunately, the first item on my agenda for the past year and a half has dealt with school, dealing with COVID situation and opening plans and reopening plans. Last week, we had learned that the executive office nor the New York State Department of Health was going to come down with any guidelines as they did last year for schools to reopen in September. They left it up to the local governmental agencies to do so, thereby meaning the Board of Education for us. We, as superintendents, would also look at Nassau County as a local governmental agency to provide guidance. We have had several meetings. My organization has had several meetings with the county officials, the Department of Health in Nassau County, and no guidance seems to be forthcoming. However, we did hear that since we're not getting any other guidance from other agencies, that New York State Education Department will be supplying some guidance for schools, and that should be forthcoming rather shortly. However, once we learned that we were not getting guidance, our task force that met all last year, if you recall, and now we're up to phase 5 of that task force, we met last week to begin to discuss what we wanted to do, since the decision seemed to be left up to us. So we went through different areas that needed to be addressed for the reopening, and barring any major changes that may come down from the State Education Department, which, by the way, we've also received the hint that the State Education Department's guidance will be based on the CDC guidelines. So with that in mind, we take that into consideration, and I will share with you what our task force is going to recommend to the board, and they're pretty much almost in sync. And I know this is a controversial issue, but I just want everyone to know that our task force all year long, and even the group that met last week, I have to commend everyone for giving up their time and for not thinking about themselves and for thinking about the health and welfare of all of our students, and thinking really what is in the best interest in order to keep our schools open, to keep students educated in person as long as possible. So I just want to publicly thank everyone for really all year, all those different, we had different members all throughout the year because we wanted to get more people involved in the decision-making process. So that being said, the task force is making the following recommendations for the Board of Education to consider tonight. As I said, welcoming all students back to in-person learning is our #1 priority. Therefore, the first recommendation is schools will welcome back all students for in-person learning, meaning no remote learning option will be offered. We are going to return to pre-COVID schedules, meaning our arrival times, dismissal times, bell transitions, use of lockers, use of locker room use will continue as they did pre-COVID. Elementary early morning drop-off will also resume. Schools will not be required to do the daily health screening. However, based on everything that we've learned last year, if one is sick, stay home. We are encouraging everyone to stay home. Schools are retaining the portable washing stations, and frequent hand washing and use of sanitizer will be encouraged. The schools will maintain 3 feet distancing where possible, and this includes the music content areas. Schools will require all students and staff to wear masks for all indoor instruction and activities. Thank you. This includes bus transportation. Masks must be worn on buses. Masks will not be required for outdoor activities. Let me just explain some of the rationale for this, because those people who may not have clapped, so thank you for clapping, those people who may not have clapped and wanted a different response for the mask wearing is, the game changer for the task force was if everyone is wearing a mask, and if you think about last year, how many healthy children were put in quarantine, right? And we had to provide that hybrid instruction, and they were at home, and they were healthy, and they had to sit at home for 10 days, right? That was not good. And we're not offering remote learning this year, right? So it's in school or you're out. That's what's taking place this year. So the fact that we are wearing masks, the CDC guidance has allowed us to not do contact tracing. So you could be next to someone. Dr. Lynch is wearing a mask, I'm wearing a mask. He may develop COVID. Because we're both wearing masks, I do not have to stay home. He has to stay home, but I do not have to stay home. That was a game changer for our task force, and I hope that that makes some sense as to why that was one of our key pieces of information to require the universal mask wearing for all indoor instruction. Okay, I said we would not do contact tracing. We will not quarantine healthy individuals. That does lead us to lunch, okay? Schools will cohort lunch tables so that when masks are not worn during eating, the process of contact tracing is greatly reduced and less students will need to be quarantined. So think about it. You can't wear a mask when you're eating lunch, right? So we're going to assign seats at lunchtime, and so this way we will always know who is around any potential COVID positive student. And those students would be the ones who would need to be placed in quarantine. Schools have eliminated the polycarbonate partitions, except for speech classes, actually, where viewing one's mouth is vital to instruction. We will allow the polycarbonate so that we will have that layer of protection for that instruction. And actually, the district has arranged for a testing company. If you recall, last year we approved a contract with ATC, it's around-the-clock testing, and they will conduct rapid testing on September 9th. And that will be at every building for anyone who wishes to take advantage of this service. So if you want to start the school year and you want to know, you can get a rapid test at every single building, whether you're staff or student, and then you will know before walking in to the school. And just so you know, insurance was always an item for discussion with the board. They will accept whatever insurance that you have. If you do not have insurance, you would just put not applicable. I will send a link following this announcement, and you do have to sign up in advance. So if you don't have insurance, you would just put not applicable. If you have insurance, you would upload that insurance. And when you upload it once, you can get tested throughout the year. So if we bring back the testing company to continue to test throughout the year, you only have to submit your information once, and you can do it. And then even if some people were concerned, well, my insurance company only covers 2 testings a month. If you've exceeded your number of testings, ATC, they'll accept whatever you have, and no one will be privately billed. Okay, so hopefully that resolves that issue. Those were the main items that the task force discussed, and those are the recommendations that we're making to the Board of Education. Again, I just reiterate, the state is now coming down with some guidance for us, but we do believe it will mirror, so to speak, the CDC guidance, and we've done our best to try to do what's right for Lynbrook, right for the students and staff of our schools, and I'll leave that up now to the board for discussion.
I mean, I guess my concern was that the purpose of being vaxxed was to avoid having to wear the masks. But the problem is we are not giving any guidance. The only thing that exists right now is the CDC. And whether or not how I feel about it, to me, isn't as compelling as the fact that I think the worst condition is to have a kid in school, even if that kid chooses or his parents choose not to have them wear a mask. We'll be sending home healthy kids who are not only going to miss out on their sports and their chorus and their drama, are also going to have no remote learning. So I can't buy the argument for them. So that's something I don't think we can risk. As well as under the America's Rescue Act, there's language in there that says if we don't comply with the CDC, we're at jeopardy of losing, which for our district would be $4.2 million. So those are the things, to me, while I think there's positions of persuasion about the mask, the possibility of all those factors, to me, make it difficult not to have, come September first day of school, having a full mask policy, so we avoid having these kids go home and we avoid the jeopardy of losing that money.
And may I just add one other thing? Last year, throughout our discussions, remember there was always that confusion. CDC said one thing, the American Academy of Pediatrics said another thing, the state health department said another thing, and we were all year long, we were trying to figure out, where was the middle of this? What should be the right thing? And the task force had debated, the members of the task force debated back and forth, which guidelines should we follow? This year, the American Academy of Pediatrics and the CDC have aligned themselves with that guidance. So that's a little more compelling for us, and why the task force felt comfortable making this recommendation to the board.
If I could too. Just my personal background as an educator, the worst part of this whole crisis for me was the students who had to be home when they could have been in school. what they lost socially by that, what they lost instructionally by that, what they lost in terms of maturation and development and just normalcy, because they had to be home when we had to cohort, because we had to, the only way to spread out enough was to cohort and all that stuff. I think it was the worst part of that for our students. And if we avoid all of that by requiring masking in schools, I think it's a small price to pay for the benefit we have of having every kid in school every day learning with their teachers and peers.
Yeah. I also think now the building itself is going to go back to its pre-COVID. We're not going to have one-way hallways, and access to the bathrooms is going to be as it was before, and clubs, sports, it's all coming back.
Correct.
Okay. So this will be the one holdover.
Correct.
Yeah, I would also like to thank the reopening task force for all the work they've done throughout this entire pandemic. You know, based on their recommendations and the CDC recommendations and the American Academy of Pediatrics recommendations, and the fact that by wearing masks we will be able to keep the most kids in school for learning is, you know, truly important.
And just a question, are we waiting on guidance from Section 8? Are we thinking they'll come out with guidance regarding sports and indoor sports? And
I have not heard anything about Section 8.
And you know, we're lucky enough as board members, we have a lobbying group like a lot of industries do, and they lobby on our behalf. And one of the things we will ask for is local control, and they met today with the state. And Albany has conveyed to them at this time they have no desire or are not compelled or interested in getting themselves involved. At least the Department of Health has said that at this point. The problem is we look like we're getting a consensus of what we think things are going to be, but we do meet again on September 1st. And, you know, hopefully we won't have to do what we did last year and have emergency meetings and meet in 2 weeks. I think whatever they decide to do, if we have to pivot or improvise, we have an opportunity to do that on September 1st. But at least we're getting a sense of what we're looking to do now. Keeping in mind that Suffolk County came out with some decisions. We don't know what NASA, you know, there's county government, there's state government, there's State Department of Health, there's County Department of Health, there's State Education Department. There's a lot of different agencies that have 4 or 5 weeks to weigh in on what we're going to do. And as we know, there's other states, other school districts in this country have already started their schools this week. And I'm sure our state is looking at them to see how this virus is working, what impact it has on that. But I think the idea that we can get back to what our goal was all along, if we think back to when this started, our goal was to get back as close as we could to normal. And if the only thing that we have to do is to wear the mask, it's a pretty compelling argument to go back to school if that's the only thing we have to do, notwithstanding what we may hear over the next 4 weeks. So I think the contact tracing, that $4.2 million is still looming over our heads, what the federal government wants to do with that. So,
You know, I would be remiss without saying this, but I do agree that it's somewhat crazy that the state government and the county government has not made this decision, but you especially, Mr. Belmont, for the 13 years I've been on the board, has been, you know, yelling about local control, and this is the ultimate local control. So I feel like, you know, we have a consensus among the board that we are happy with the recommendations of the, you know, reopening task force.
Mr. Marcus, I agree completely about local control being in the best interest of the district, but I almost feel like, selfishly, I don't feel like this should be decided locally.
I don't
feel
disagree
like,
with you, but,
yeah,
but at this point, we don't have any other.
We don't.
You know,
And
we're following the same guidelines that we're told that the Department of Health is going to be following, so we're
Right.
not.
Right,
If
and
anything, they're
it
not
just
going-
shows a complete lack of leadership at the upper levels of
I
the
don't
state, and
disagree with
it's
you on
remarkable.
that.
The fact that this is still going on is insane to me. You know, I want to do a good job as a school board trustee, but I am a teacher. There are a few teachers on this board, there are a few lawyers on this board. There are no medical professionals on this board. You know,
But we're not, we are following
No,
medical
I understand
guidance
that.
from
I
above.
understand that. And the fact that it didn't come from up top is, I think, disgraceful. I don't think it's crazy. I think it's disgraceful. And I hate the idea that these kids are going to have to wear masks again starting September. But truth be told, what choice do we have? It's the only, choice to make. I mean, when the American Academy of Pediatrics says that this is what we have to do, as a math teacher, I don't feel comfortable disagreeing with that. And that one email we received from, I believe it was 236, school
Medical
doctors on the
professionals,
island
doctors,
imploring us to put these kids in masks. I mean, I don't want my kids in masks. I don't. They went and got the vaccines. They did what they needed to do. So when September rolled around, this would be done. But it's not done. It's still going on. So the right move is to agree with the medical professionals. And the fact that it's being done locally, though, to me, seems nuts. It really does.
I don't disagree with you. I think it's crazy that this is what they chose to
Right.
give us local control over. But I guess that's why we're paid the
Right.
big bucks, so.
Yeah. But really, there is no choice. This is what we have to do.
I would still argue that between now and September 1st, there will be something out from one of those multiple agencies. It's been consistent all the way through. So it's nice that we have a sense of what we're doing and where we're going.
Right.
And Dr. Burke and the staff and the administration, all the way trickling all the way down, can prepare for that. But we have to be
But if there
very
isn't
aware of the
something
fact.
out
Well,
by then, we're going to be following this guidance.
Correct. And just keep in mind, as we did all last year, we were flexible all last year. As things changed, we changed our plans, and we altered and we modified to keep our education going. So if I'm hearing that there's consensus, what I would like to do is communicate to the community at large and send out a letter this week so that this is now what to expect for September, barring any drastic changes from any other guidance that we may receive, and it is coming from the State Education Department. But we'll see. There may be additional things that they're requiring that we do, and there may be some changes. But at this point, if everyone feels comfortable, I will communicate this to everyone.
If you could just add, because I don't know if everyone in the room knows the broad makeup of that task force, so they know like how many different stakeholders had input in the recommendations that we're accepting as a board right now. Like, these recommendations were not created by the board, they were created by this task force, which had a pretty broad swath of stakeholders. If you could just maybe mention that.
Sure. As they did through every phase of the reopening task force, we had parents, teachers, teaching assistants, nurses, administrators. There were custodians. Students. Student couldn't make the last meeting because, quite frankly, the last meeting was called to action rather swiftly because we needed to get some information before this board meeting. But throughout every single phase, we had representation from the broad spectrum of stakeholders in the district. Okay,
Yes, Dr. Burke.
thank you.
Moving on.
Okay, some happy news. Again, the district has been awarded a Certificate of Achievement for Excellence in Financial Reporting for its comprehensive annual financial report for the fiscal year ending June 30th, 2020. So I would like to publicly thank Dr. Lynch and the entire business staff for being so transparent with the financials. And as you can see, there is really no rest for the weary in that department. On top of everything else that's taking place, there are 3 concurrent audits, as you heard Ms. Danino just say. So it's an office that does not sleep. So thank you very much.
I just want to add, I've sat on the audit committee for quite a few years, and Paul, everything is just as neat and tidy and organized as it could possibly be. So congratulations for an award you well deserve.
Ditto. Speaking about neat and orderly, capital projects update. We have a lot of debris around the high school, so we're just going to give everyone an update on the construction.
So as Mr. Belmont indicated, the board just had its unveiling of the new wing. The new wing is in great shape. It's really ready for September for the most part. We are still working on the banana wing, but that is also scheduled to be done. The science rooms will be in good shape, so we do hope to have an opening. We'll still have punch list items to get to, but we are still on schedule for an opening of the new building. And Mr. Sada's in the back of the room, who has been our director of facilities, and he has been guiding this project. And I don't know if his family is looking at home, but all the time that he's spent away from them and all that he has given to us and has not given to them, I think on behalf of this board and on behalf of this community, we just want to thank you for all that you've done. It's been one hell of a Marion Street, the elevator. If you live near Marion Street, you kind of have seen what's going on there. So the good news is the chairlift is hopefully going to be functional by this September. So that's in the nurse's office. The ramp is in place also, so some of those ADA things that we had to accomplish were done. The rooms that had to be ripped out in order to accommodate the new elevator room, they will be put back together and they'll be ready for actual service of children in September. The elevator itself, though, is still going to be worked on throughout the autumn, so we just wanted to indicate that. And then also, if you live anywhere near Atlantic Avenue, you've also seen that there's a lot of mess going on out there, and our parking is just there's a new boiler going in there, and again, that's another. These are 100-year-old buildings that we're working on, so it really is quite some work that's been going on, but everything is progressing as it needs to progress.
But just so everyone knows, we are still victim of some of the supply chain issues. Some of the orders of equipment and furniture are delayed, so we may not have everything in place for the addition in the high school, but we'll be welcoming children on September 8th, but it just not be everything that we have ordered as part of the bond.
One thing I'm looking at my notes, people who live in this area of this high school should know that National Grid is going to start to rip up part of Union Avenue tomorrow to accommodate the new gas line. So that's another thing that the trenching will begin.
Thank you.
Thank you, Dr. Burek. Anything else from the board? This time we'll move to public comment. If you'd like to address the board, please come to the microphone, identify yourself, and indicate if you live in or out of district.
Good evening, board members. First off, thank you so much for your generosity with your time, and we appreciate your decision making in this difficult time. My name is Brett Linzer. I live in the district. I'm a parent of two South Middle students. My good friend, Dr. Mohammed Ghafoor, a parent of three Lynbrook students, asked me to read a letter on his behalf as he couldn't attend tonight's meeting. As I have great respect for Mohammed's opinion and reasoning, I'll happily agree to read it. Also, I just also wanted to mention, before I read this letter, I wanted to also add that I'm not pro-mask. I don't think anybody wants to wear a mask. However, I do want to keep my kids and my family safe, and if the majority of medical experts who I trust recommend wearing a mask indoors, then I'm happy to deal with a minor inconvenience for the greater good of my family and the community. And now here are Mohammed's words. My name is Dr. Mohammed Ghafoor. I am a Lynbrook resident and a parent with a son entering first grade at Marion Street, as well as a son and daughter at Lynbrook South. I am also a pediatric critical care physician and director of the largest pediatric intensive care unit in Brooklyn. I have spent the last year and a half caring for the sickest children and adults with COVID-19. I have had friends, colleagues, and patients who have gotten sick and died from COVID-19. I am in full support of the CDC and American Academy of Pediatrics guidelines that support indoor masking in public schools. There are three main points I want to make about this topic. The first is about science and expertise. Having been involved in one of the reopening committees and having watched the district's response to the pandemic, I have always admired that the district has followed the scientific recommendations from national experts, even in the face of opposition from vocal parents. Public health decisions designed to keep children healthy and safe should be made by superintendents and school districts with the input of reputable medical health experts. They should not be determined by the loudest voices in the room. I realize that following the experts can be frustrating. It seemed like we were on the tail end of the pandemic in the late spring. However, the Delta strain spreads much easier than the original strain of COVID among both vaccinated and unvaccinated people. Currently, we are seeing a rise in COVID cases and hospitalizations around the region. Looking at the data for just Long Island, the number of hospitalized COVID patients have gone up fivefold in the last 30 days. While this is not at the level we were back in the spring and winter of 2020, it is a concerning trend. In my hospital in Brooklyn, we are starting to see an uptick in adult cases, and yes, even starting to see pediatric cases again. In my conversations with colleagues around the city and Long Island, they are seeing similar trends in their own adult and pediatric units. The common theme in these cases is the lack of vaccination. The adults have chosen not to vaccinate, and the kids are ineligible to be vaccinated. The second point I want to make is about misinformation. There's a lot of noise out there. Also, thanks to our sensationalist media on all sides, the press throws out attention-grabbing headlines to get their viewers fired up. My first reaction when I read or hear something on the news is to go straight to the source. I am constantly speaking to my adult ICU infectious disease colleagues and other pediatric ICU doctors around the area. Based on what I'm reading and hearing from colleagues, I believe that the guidance from the CDC and AAP is the absolute correct move for Lynbrook schools. The third point I want to make is about community. One of the best things about Lynbrook is that we embody this American ideal of a community coming together. I experienced this firsthand during the COVID pandemic. When masks were in short supply, neighbors unsolicitedly dropped off their spare N95 leftovers from their household renovation projects at my door. A Lynbrook mom created a mask-making group to make masks for healthcare workers. I was proud that my wife and daughter helped make some of these masks. Neighbors left food at my doorstep. A group of Lynbrook parents pitched in and bought food for my entire intensive care unit. Helping your neighbor is what masking indoors is all about. While masks offer some protection for the wearer, the primary goal is to prevent the spread of large droplets from the wearer to those around them. When you wear your mask indoors and put the mask on your kids, think about your neighbors. Think about the neighbors that are immunocompromised and despite being vaccinated are at higher risk of getting seriously ill from COVID. Think about the 4 buildings in our school district and some of the 6th graders in both middle schools who are unable to be vaccinated. And yes, think about your misinformed neighbors who made a choice to not get vaccinated and end up hospitalized. Thank you for your time.
Thank you.
Thank you, Ben.
Hi, my name is Jennifer Hinderstein. I'm a resident and a parent of an incoming junior at the high school. And I want to thank the board for making the decision based on the committees to make masks mandatory in school. I truly believe it's the right decision. So I'm not going to give you facts because we don't need to share our facts and I can't compete with the doctor. I do have one question though, in terms of, because you're talking about what may come down from the state later down the road. Are you in any way worried that the state will say that districts cannot mandate masks?
Well, I wouldn't use the word worried, but there is a possibility that the state can come up with any rules they want, especially when it comes to masks and vaccinations and the combination of such.
But is that something that we need to really think? Knowing what you know and having been, do you think it is a serious thing that we need to worry about, that they're going to say Lynbrook School District cannot mandate masks?
No, I don't think this is down south, and I can't imagine this state mandating that you can't wear masks.
Can't mandate wearing masks. Okay, that's so whatever happens, it happens. I had a prepared statement, but again, I don't really need to read it because I think we're all on the same page, and I want to thank you for doing what's best for the children. Thank you.
Thank you.
Hi, I'm Allison Greenberg. I'm a resident and I have an incoming freshman into the high school. My question, Dr. Burek, is you said for lunchtime there may need to be kids quarantined. I'm asking on behalf of people who have vaccinated children, if your child is vaccinated, they shouldn't have to be quarantined. Is that correct?
The way the guidance stands right now, they may not have to be quarantined. However, we still want to see that guidance in great detail, because right now, the exception that has been given to K-12 schools is that the protection is both people wear masks, and then that's when you don't quarantine.
Correct. I just wanted to, hold on, if I could get this open.
Remember, there's always been two sets of rules, right? A set of rules for the world and a set of rules for school.
I get it, but the Secretary, Miguel Cardona, tweeted on Monday, students, if you are vaccinated and exposed to COVID-19, you do not need to quarantine if you do not have symptoms. Just get tested 3 to 5 days after exposure. Getting vaccinated means no missed classes, sporting events, or time away from friends.
Correct.
So on that note, if kids happen to get quarantined, you've said there's no remote learning. What happens if some healthy kid gets quarantined for 10 days? What are you guys going to do in terms of them having access to their classes?
Well, right now they would be treated as if someone were sick, and information, now that we have the learning management system, information would be pushed out through the learning management system for them to work asynchronously. At least that's on the secondary level. The elementary level, because those are formative years and kids kind of need direct instruction, we're working on an arrangement on the elementary level to provide some direct instruction for students on the K through 5 to receive some live instruction during the day.
Okay, and then I have a question completely unrelated to COVID. Is there a place that I can find a map of the new high school and how the rooms are numbered?
When it's finished, we'll be able to have that.
Okay.
I do know that the high school has renumbered all of the classrooms. We just don't have it in paper format yet.
Okay.
But that will be forthcoming.
Okay, thank you.
Yes, he does have something. Yes, that I know.
Thank you.
Because we had to order the numbers.
Good evening, Mr. President, members of the school board. Jeff Greenfield, citizen, taxpayer, NGL Realty, 112 Merrick Road. I'm either the first or the last taxpayer in the district, depending upon whether you're coming or going on Merrick Road. Congratulations to the re-elected board members and the new member of the board. I heard your report on the high school construction. I'm glad I've been watching it. It's moving along. Be ready for the opening of school, in spite of some delays you had last year. But tell me the budget for the high school. Where do we stand with that? Are we within budget, over budget?
Oh.
We must know the change orders that we've approved.
Yeah, we're within budget.
It's coming in within budget? What?
It's definitely coming within budget. The final change orders we will start to get to know very soon. The auditorium's still yet to go, but we're in very good shape right now. Yep.
I'm glad to hear that.
Yep.
What was the contingency on the budget for the high school
18%.
renovation?
I want to say I pulled that. Jeff, you got to compliment me on that. 18%. I remember that. Yes, that was. Yep.
So that's a healthy contingency.
That was a healthy contingency. Yep.
Okay.
Yep.
So we have room. With respect to the contract you're going to approve with the JCC and the pre-K program, what kind of coverage on a certificate of insurance are you receiving, and in what amount, hopefully including child molestation?
Yeah, absolutely. So NYSER, who is our carrier, has if I think it's $5 million, and it's $5 million on the umbrella. There's a sexual misconduct. There's general liabilities, $5 million an occurrence. The umbrella is $5 million. So we're following the exact recommendations of our carrier.
And the same coverage that you have here.
Correct. Yes.
Yeah, that's important.
And we're going to be named. Yes,
that
as
amount.
Yep, that was our.
And who reviews that certificate?
NYSER itself. We send it to Right Risk. Yep.
Okay, thank you. Dr. Burek, in your report on the reopening and the protocols, you didn't mention the issue of vaccination of teachers and staff. Do you have a policy on that?
No, there is no recommendation. You're talking about mandating vaccinations?
Yes.
Yeah, that is not a recommendation to mandate vaccinations. We are encouraging vaccinations, but we are not mandating.
Are you encouraging them to share with you their vaccination records?
At this point, no.
So you have no idea what percentage of your staff is vaccinated, or teachers or staff?
Not at this time.
I would hope that your committee would reevaluate that and look at that. And I think it's not out of line, like most businesses are asking that question. I'm not advocating terminating anyone for electing not to be vaccinated, but I think you should have a knowledge of what percentage and who and where have been vaccinated, both with respect to not only the teachers, but the staff, anybody that comes into contact with the students. I think that's very important from a liability standpoint. And I wish, Mr. President, that you would reevaluate that.
I'm not sure, Dr. Burek, as with other employees, and council can weigh in this, I don't believe that's information we can dictate to a union, correct?
Correct. I've seen reports in the press that it's allowed to ask that question. You can. So there's a difference of opinion whether you can mandate vaccination, and I'm not saying you should mandate vaccination, but I don't think it's out of line for you to record that information and ask people if they've been vaccinated, as far as the professional staff.
I think that rule hold true for other aspects for other professions, but teacher unions, for the protections and mandates and information they have and how they negotiate things, we've been told continuously that's not a question they need to comply with.
Okay. Is that true, Counselor? Well, that's a deficiency then. In future contracts, maybe you want to cover that issue. When is the contract up with the teachers union?
23.
What?
2023.
Okay. Thank you very much. Have a good evening. Enjoy the rest of the summer and have a successful opening of school.
Thank you.
I have a question on behalf of a person who's watching us virtually, and they're concerned that there will not be, I know you explained it, but perhaps you can explain it again, why there wouldn't be a virtual option for high school students who might be quarantined.
Because as we have seen this past year, that the hybrid learning, the concurrent learning, teaching those in person and those at home is not an effective way to teach. And our goal is to make sure we have more kids in person learning. And that is just our priority. A lot of times people stayed home for the wrong reasons last year.
Seeing nothing else from the community, anything else from the board? We have one sympathy resolution this evening. Whereas the members of the Board of Education of the Lynbrook Union Free School District have learned with sorrow of the recent passing of Mary Jane Phillips, former stenographer and secretary for the Lynbrook School District. And whereas Mary Jane Phillips served as a stenographer secretary for 33 years, from 1975 through 2008 at Lynbrook High School. And whereas the Board of Education is mindful of the contributions made to our district by Mary Jane Phillips during her years of service to our community. Be it resolved that the Board of Education records its sorrow, its sympathy, and the esteem in which Mary Jane Phillips was held. And be it further resolved that a copy of this resolution be sent to the family of Mary Jane Phillips with the hope they will find solace and comfort in the rich heritage of good works for which she is remembered and revered. Would also like to acknowledge donations. The board gratefully acknowledges the following donations: 5 owl carpets, 2 sensory pathways, and books valued at $1,400 from the Marion Street PTA. Moving on to superintendent recommendations. If you are following along, we are skipping Resolution 2108G10 as it is a duplicate. I'd like to ask for consent agenda on Resolutions 2108C1 through 2108C21, 2808G1 through 2108G9, and 2108G11 through 2108G42. May I have a motion, please? Mrs. Dino, second. Mr. Murray, may I have a motion to accept the consent agenda? Mrs. Hanson, second. Mrs. Marcus. I'd like to also ask for a motion to adjourn to go back into executive session to discuss matters of personnel. Mr. Yakers, second. Mr. Lesky, all in favor? Yes. Well, Mrs. Dino says no, but she's outvoted, so she's going back anyway. So everyone, enjoy the rest of your summer. We'll be meeting again on September 4th, and hopefully there won't be too many changes.